So I think what we've seen in the last 10 years is, some really exciting examples how, in particular, blood cancers, either new drugs or new transplant therapies are delivering treatments for patients whose outcome with standard of care would have been very poor. And I see an acceleration in the range of new targeted therapies which are available, which target specific abnormal pathways in patients with diseases such as leukemia. But I also see extraordinary progress in an area we call immunotherapy, which is where you use the patient's own immune system to fight the leukemia or the lymphoma. And finally, and this is probably the best example there is of immunotherapy, we're seeing stem cell transplantation even more safe, but most importantly, new strategies to mean that more leukemia is eradicated and more patients are cured by transplant. So I think we see ourselves positioning patients with the opportunity for new treatments that otherwise wouldn't have been available, and thanks to Cure Leukemia's amazing work funding national transplant and blood cancer trial networks in the UK, patients increasingly will have a choice as to which is best. Is it new targeted therapies? Is it immunotherapy? Or should they go to transplant? But in all of those areas, what's vital if patients are to get the benefit from these treatments as quickly as possible is we have the infrastructure, the nurses, the networks, the empowered clinicians, the trial delivery vehicles that allow us to deliver these trials. And really, Cure Leukemia has been amazing in the last 5 years in pioneering this critical infrastructure so that patients can now reap the benefits of all these advances that are being seen in terms of drug development. And realistically, if we maintain this progress, you could see in 20 to 25 years that every patient with blood cancer will have an effective treatment. But that's only going to happen if we keep providing this critical infrastructure to empower patients so they can access the trials they so richly deserve.